petition to make a community Meals on Wheels a statutory service for vulnerable people unable to access a fresh, nutritious daily meal. According to the already busy charity, this would save billions of pounds in cost to the NHS and adult social care by addressing the cost of associated malnutrition and related illnesses. Additionally, it would improve health outcome while combating loneliness and social isolation. I met with Lois Russell-Moyles, the Labour MP for Brighton Kemp Town, and Bryan Coyle from the East Brighton Food Cooperative. Oh, welcome back to Latest TV, right?
Thank you very much, William. Hello, Latest TV.
So, what we got behind you?
But basically, the East Brighton Food Cup done a national review of the benefits of community meals and meal services. And in this country, we spend 20 billion a year treating the causes of malnutrition. No, we're treating malnutrition. We don't spend anything preventing it. Now, there's no cure for cancer. There's no cure for leukemia. But there is a cure for malnutrition. It's called giving someone a meal. And to spend 20 billion a year, you know, people can't get discharged from hospital. People are staying in hospital for longer. I mean, the costs are phenomenal. And we need to start thinking logically and join up the dots. If you give someone a meal, they won't be readmitted to hospital. They won't need to go into a care home. When they are in hospital, they get discharged quicker. You know, it's a non-brainer.
So what happened when people scan a nice, beautiful QR code you got behind you?
Yeah, so the QR code, so we've basically got, if you scan the QR code, that will take you through to our report, which outlines the health benefits of community meals and meals, but also the petition. We've got a government petition now that we started a couple of weeks ago, and we need to get 10,000 signatures in the next 6 months for them to debate it. So, you know, it's £20 billion of our money we're wasting here. If you sign a petition, you will help the NHS because you'll save lots of money.
What we need in this country is to tackle malnutrition. We need to make sure people eat well. And there are many ways of doing that, but one of the key ways is to make sure we provide good food to people's homes. Meals on Wheels services cut all over the country over the last decade or so, and people have started to go not only hungry, but they eat badly. And actually what the East Brighton Food Co-op has done at a local level is start to fill that gap, start to provide good, decent food to people. But now we need that to go national. We need a proper service, coordinated across the country, funded properly, that will save our NHS money, that will actually start to ensure that people can live healthy and well in communities, and will be able to start contributing to our societies. So a proper funded national food service is, of course, what we need, and we need something to ensure that people in their homes eat well. And that includes education as well as providing people food. So I'm definitely supporting what the East Brighton Food Co-op has done here locally in Brighton, but now what we now want to do nationally.
So, as Brian mentioned, and might don't mean like prevention for cancer or leukemia, but prevention for malnutrition is pretty straightforward. All you need is food.
Yes, prevention for malnutrition, prevention for all the problems that we have because of food is easy, and it's actually cheap to cure. At the moment, it's such a huge burden on our health service and on our society, and we could save that money, and we could actually let people live better lives.
So we just need 10,000 signatures for this petition, and then what would happen?
Then it will have to be debated and discussed in Parliament, be discussed at the national level. That's what we want.
Yeah, and another thing, I've talking to directors of adult social care around the country,
yeah,
and a lot of them have been involved in actually closing down meals and meal services in the last 30 years due to austerity. That's the reason why we've got this petition, because we want to make meals and meals a statutory service. That means local authorities will be obligated to provide a meal. At the moment, they're not obligated, and it's easier to take the short-term answer of, let's save a couple of £1,000 by letting that person have malnutrition. Now, you put that across the board, that's the reason why we're spending 20 billion a year as a country. But we've given our review to adult social care at Brighton Council. We're waiting for them to get back to us. But, I mean, our case is adult social care should be contributing towards the cost of this community meals and meal service. So we're hoping the council is going to get back to us soon, because we desperately need their help.
So at the moment, how is East Brighton Food Cooperative financially itself?
Well, I mean, it costs about 169,000 a year to run this service, and that's providing a safety net for like 130 people, giving them daily meals, stopping them from malnutrition, stopping them having to go into the care system. We raise 85 of that through donations and private fundraising. 35 of it we got from the Household Support Fund, and we're now like 50. We need an additional 50 from adult social care. Now the good news is the government put aside. They launched a £500 million fund in July for adult social care for the next year and a half, and the three provisions of that was to help with hospital discharge, to stop hospital admissions, and to retain or increase the adult social care workforce capacity. So East Bright Food Cup fall into those all three categories. We tick every box. So, you know, it's, you know,
No brainer.
It's a no-brainer. So we're hoping that adult social care will be in touch with us pretty soon.